All right, we are live, Dr. Ergau.
Perfect.
Good afternoon again. So I was running a little bit late, sorry. Today is February 18th, Friday, Bariatric Friday. This is the American Surgery Center. My name is Kemal Erkan. I'm the chairman of the program. I'm here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
Very well, Kemal. Thank you. Always great to be back on Bariatric Friday, one of my favorite spots of the week. To just introduce myself again, I'm Dr. Irgau. I'm the president of CHRIAS, or Christiana Institute of Advanced Surgery, which is a practice that also specializes on weight loss surgery or bariatric surgery. I have been performing weight loss surgery now for 20 years. And with my associates, our group has been responsible really for establishing the modern type of bariatric surgery in our area, establishing centers of excellence in the main health centers in our area, whether it's Christiana, St. Francis, or at Bay Health. Again, I'm very happy to be here to talk about another important topic in bariatric surgery.
Thank you. Our audience, they already know our format. So we have bariatric weight loss. This is a big topic. So we divide it into smaller sections, smaller topics, and then we discuss it every Friday, more like a coffee table discussion. So then you have the surgeon, you have the person who's in charge of the program from the administration side. So the best of the two is just telling you what we do, what we go through every day, what our patients are going through. We have tried different type of presentations. We do have more like the full-fledged presentation on Tuesdays. The purpose of this event is slightly different. So we pick a topic, and then in some cases we may be discussing different issues that we are going through. Like I have one, for example, today that I'm going to probably talk about. I answered the phone, for those who said that I don't answer the phone, just to prove that they prove that they were wrong. I answered the phone, and I'm glad that I did because I knew who was calling. So, and then that's what we want to kind of go through in these meetings, in these discussions. So now today, the discussion is going to be around once we go through the bariatric surgery, someone goes through the bariatric surgery, there are certain things that they need to follow. Maintaining the weight loss is extremely important. So we are providing a lot of support, a lot of tools for our patients, a lot of knowledge for our patients. So today, Dr. Irgau, I would like to get some education from you in terms of what happens after the bariatric surgery, after the weight loss, especially what types of behavior changes are happening, how they should be preparing, our patients should be preparing themselves after the significant weight loss that they're going to have.
Absolutely, absolutely, Kemal. This is a very important topic. This is a topic, obviously, that is inquired about by patients very often. You know, Dr. Irgau, they say, is it possible to regain weight after bariatric surgery? Well, the answer to that, yes, it is possible, right? But it doesn't have to be that way, of course, right? Bariatric surgery currently is by far the most powerful tool we have, the most powerful treatment we have against morbid obesity, people being able to lose, 80 pounds, 100 pounds, 120 pounds or more through bariatric surgery. The question obviously is how does one maintain that weight loss? Clearly, the tool is permanent in most cases, right? If you take the most common procedures that we undertake, whether it's the gastric sleeve, where we are cutting a portion of the stomach and removing it completely, leaving just a small portion of the stomach inside, or whether we're doing gastric bypass, where we make a small stomach, but we reroute the intestine. These are permanent changes, and they stay permanent. For instance, when we make the stomach very small, and people hear about the possibility of weight regain, they ask me, well, does my stomach stretch? Does it go back to the original size? And of course, the answer to that is no. The stomach can never go back to the original size. But it is possible over time to introduce additional calories that small, little by little, can end up getting that person to gain weight. So that's why really adjusting one's behavior, one's lifestyle afterwards is critical. And part of the reason we have the program, Kemal, as you know, is to really prepare patients adequately. Many of our patients have to go through many sessions with nutritionists, with the bariatric surgeons, with our bariatrician, right? To learn about good eating behaviors, right? To learn about what good foods are, healthy foods are, and what the ones that are not healthy are, right? And how to decrease calorie intake, how to increase physical activity, all tools that are important and go hand in hand with bariatric surgery to make that weight loss permanent, right? Mm-hmm. So when we are telling people you need bariatric surgery in order for you to lose these 100 pounds, 120 pounds, 150 pounds, and become healthy, so you can liberate yourself of medications for diabetes, medications for high blood pressure, CPAP machine for sleep apnea, and many other illnesses. What we're saying is that this is a tool. We know that you have tried diets hundreds of times and you have not been successful. We know that you've tried to exercise many times and nothing has changed. What we are saying now is, we're not saying stop those attempts. We're not saying stop eating healthy foods. We're not saying stop exercise just to have bariatric surgery. What we're saying is we're adding bariatric surgery to those efforts, but continue those efforts, continue the healthy lifestyle.
Now, actually, let's let me ask you this. So maybe not necessarily ask, but perhaps just like for those who don't have morbid obesity, like hopefully you and I, we are not yet morbidly obese, so we are. But what do we do to keep it off, not to be morbidly obese?
Absolutely, absolutely. So there are certain basic things we talk about, right? It's all about, for instance, calorie consumption. Come on, okay? Mm-hmm. Let's talk about behavior, for instance, right? So one of the behaviors that is very damaging to us living in our country, where food is pervasive in its presence. It's everywhere all the time, right? Yes. And that can lead to a behavior known as grazing, right? Where we are munching and eating continuously, right? You go to somebody's office, Kemal, what do you see on their desk besides, their computer or other things? You see a little bowl where there may be candies, where there may be snacks, right? That happens all the time. You go to the bank nowadays, Kemal, they will give you candies right at the counter. They will have that, right? So food freely available with high calories everywhere, right? It is a problem. So we have to recognize that and avoid that. So grazing is a very damaging behavior, right? Where you're eating really continuously. Now, you don't register it as food because it's small amounts, but it's getting in. The body is receiving it as calories. And when the body has excess calories, what it does, Kemal, is it stores it. And the storage form for calories in our body is fat, right? And that's what causes us to gain weight. So that would be one of the behaviors, for instance. Another one would be excessive eating in one sitting until you're full and beyond, right? Well, if we do that very often, right, Kemal, we will accumulate excess calories. So we have to learn to eat in a mindful way, whereby when we are feeling full, we stop, right? And that fullness occurs a lot faster after bariatric surgery than before, right, Kemal? And what we're saying is, after bariatric surgery, stick to that behavior. If you feel full early, right, you barely had half of an appetizer and you're full because your stomach is small, stop. Because if you tend to
try to figure out, this is true for us. Like we are, like I always say that you and I, when we discuss the food situation, diet, fitness, if I don't watch what I'm eating and what I do every day, it does go out of control. So I think I just want to kind of maybe not necessarily elaborate because it's already clear, but just maybe explain it in a different way. So when we say this is a tool, so it's almost like a reset, so that now you're able to go back to the beginning where the morbid obesity was not the issue. I'm trying to be careful not to use certain words. So when you don't have the morbid obesity, that point that you had, or if you never had it and now you don't have morbid obesity, then those people who don't have morbid obesity, who never had bariatric surgery, they live the life in certain way that they have to follow certain regimes, certain fitness, certain XYZ every day. So this, like, to kind of maintain and do certain things, our patients have to really kind of see this as like, there's no magic. Yes, there's no magic, but also you are just going to be part of what everyone else is doing every day. So,
well, actually, Kemal, it's an interesting point. It's actually, they have to do even more. They have to do even more because they went into morbid obesity to first place because their biology is also different, right? If you talk the biology of everyone, right? Everyone will have a propensity to gain weight, right? Because that's the most prevalent biology we have in existence right now, because as people, we have evolved to learn to accumulate and to store calories, because most of our evolution, we spent it at a time where calorie availability was scarce, right? So the number one threat to our survival in the past was lack of food. So all of us have evolved in a biology that is much more friendly to weight gain than to weight loss. But there are degrees to that. There are degrees. There are some people that can barely eat a little bit and then the weight just goes up. They can do everything they can, exercise, and the weight never come down. These extreme levels, obviously people, then it's very difficult. That's why bariatric surgery is important, right? Now, in those situations, once you have lost the weight because of bariatric surgery, that biology hasn't gone away. Again, the body can go back to that, right? So that's why the teaching is so important. That's why, for instance, when I talk to patients about fullness, for instance, right? Many patients will actually tell me before surgery that they have never felt full in their life. They don't know what fullness feels, right? And they have struggled most of their life. Well, now with a much smaller stomach, they will feel that fullness, right? They will feel that fullness. And if they add a couple of more bites, actually it may become uncomfortable. And if they add one more bite, it may not stay in. It may have to come out, right? Because that is how much smaller the stomach is, right? So, Kemal, if you take a person who has never had surgery, for instance, right? Let's take a college student, for instance, right? That's going to be a good example. So a college student goes to, a party or somewhere where they want to eat, right? They eat, and they feel full, right? But the food is good. They will continue to eat. After a while, they will start having some discomfort, right? Well, they don't care. They're a college student. They like their food. Let's say they continue eating. Then it becomes painful. And then if they push it further, at some point, that food cannot stay there anymore, right? It will have to come, right? Well, for a person who's had bariatric surgery, the difference between fullness and discomfort may be one extra bite, right? The difference between discomfort and pain may be 2 extra bites of that food. The difference between throwing up because you're full now and not maybe 4 extra bites. So the stomach is really small. So they really have to learn to listen to their body when it tells them it's full, right? No matter how good it tastes, if they're full, they are full. And this is something that has to happen for them to stay healthy in the long run. Well, the danger of pushing it time after time, Kemal, is that slowly that stomach can adjust, right? The discomfort that was coming after 1 extra bite, now the discomfort may not come until 3 extra bites. Now you're learning to add 3 more bites. So this behavior that has to be learned afterwards is very important, right? So too much eating beyond fullness is dangerous because of that. So we talked about grazing as an important issue, right? Eating all the time. Yes, eating beyond fullness is the other one. Yeah.
So it's like a practical question. Yeah. So someone who had bariatric surgery, let's say their commute is about 30 minutes. And let's say they leave the office around 6. And then when they go home, they're going to eat. So let's say they had lunch around like maybe 12 noon or 12:30, and they're hungry. So they're in the car, 30 minutes ride, and then when they go home, they're even more hungry now. So and well, we don't rehearse these questions, so feel free however you want to answer.
Of course.
So see, it's always fun to ask any questions, so then you can actually choose whichever you want to answer. So do you suggest that that person maybe should have like a full glass of water before they leave their office?
That's one option. That's one option, clearly. Come on, that's one option. But another option would be to be aware of that situation and to plan ahead, right? Come on. So one very important point that you brought, for instance, is you are on the road, you're hungry, you're not prepared. What is likely to happen? You are likely to stop at a fast food place, right? So the hunger that should be taken care of with a healthy meal that you have prepared or with it at home now will be gone because you've had fast food. Well, the problem is fast food is calorie dense and nutrient poor, right? So it will definitely lead to weight regain if it's done time and time again. If you're riding past that fast food restaurant and on the clock, you're always hungry at that point, come on, then it becomes habit. And habits are habits. Good habits are great, right? But bad habits are bad because you're going to repeat them all the time. So that's why planning is very important. So eating and meals should not be casual things that we take care of on the go. Once you've had bariatric surgery, you have to plan. You have to think. That's one of the things I tell my patients, for instance, is you need to know what you're going to have the next day, whether it's breakfast, whether it's lunch, or whether it's dinner. That planning is important. We spend our life planning on many things. Why would we not plan on this critical issue that affects our health so much, right? Come on. So all these are important. So these behaviors have to be implemented. These changes in lifestyle have to occur for us to stay healthy long term. And that's why we don't just do surgery, Kemal. We have a program where we have to empower people with knowledge beforehand so they can stay successful in the long term. The other things that, go ahead.
Program, like after the surgery, I call that more like a, like the wellness club, so that our relationship with our patients are not over after the surgery. So we are there to support them. So this health team, this can be the nutritionist, this can be a follow-up with the bariatric surgeon, this can be watching these videos.
Yes.
These are all important kind of support, and we do have actually support team every Tuesday, first Tuesday of the month. Just keeping this, like assembling that team, the health team, your primary care provider. So this is one of my issues that because multiple heads, one of the responsibilities I have, I'm the chairman of the Accountable Care Organization. When I see patients whose morbid obesity is not addressed because patient didn't bring it up, and the provider didn't address it because they were not comfortable. Well, patient BMI is 52. What comfort do you need to address that problem? So, right, so we live in that type of setting, and we do have those issues. So I'm going to make sure that patients are more open about their issues, so then we can actually provide appropriate support. Now, I mentioned the phone call. So today we have 2 sessions. So 1 hour before the sessions is a little bit stressful, so that I can put proper stuff out there and then work with the team. So, but then there was a phone call, and when it's a local number, and then there was a caller ID did have the name. It was one of our patients. So I know the name is because we had the case conferences. Well, actually, it was one of those patients who have who's having an issue with the CPAP, getting the CPAP in a timely manner. We pushed the surgery date by 2 weeks, and she wants the surgery now. And I'm trying to explain to her. There was a time, Dr. Irgau, I felt the pain. Like she was like, we pushed it only for 2 weeks. And not because we wanted to push it. We want to do it also on that original date. but she was so disappointed.
Of course.
Why?
Of course.
Because there was something that was going to be delaying her procedure. And, like, although I was kind of running late and everything, I took my time and I said, okay, this was one of the patients. Like, the nice thing, we go through these patients almost a couple times a week. Now I know the name and I know the situation. It was one of the patients that I talked to Dr. Jawahar about. I'm like, okay, so actually, I know you. I know who you are. And at that point, we connected. And she trusted, because she thought, she was just like, why would she call me my number? But there was a disclaimer on the email. And if there's any like compliance, they should call. And that was my number. That's why she was calling me.
Sure.
But once she knew that I knew who she was, there was that connection. Then she felt so comfortable, and she knew that we were going to help. I called our office, and then our office is putting another follow-up. So the reason I'm mentioning this is, one, the difficulties our patients are going through. Two is this the support that we have available for our patients. So no one should feel like there is not enough support out there. You don't need to hire people like the life coaches to maintain your weight loss. So we are available, and most of the time we are free. So I just want to make sure that our patients do know that. Now, Dr. Irgau, if we were to talk about fitness and how important fitness is for after bariatric surgery, what would you like to say?
Absolutely. Let me add a little bit to what you said about support before I talk about the fitness Kemal, because this is an important point, right? So the support group that you mentioned that really includes one of our team members, but also other patients that will be talking about any issues is important, right? Because that is an area where they can really inquire and they can find some kind of solidarity and feel that they're not just themselves struggling. So that's an important part of it, okay? And then the other issue is, as you said, patients need to reach out. We want to hear of their success stories, right? When they're doing great, when they show us before and after photos, we love all that. But we also need to know when they're struggling. So they shouldn't feel embarrassed because they are dealing with a chronic disease. Obesity is a chronic disease, right? It's not a one-time disease only that stops after we do one treatment. It's a chronic disease where recurrence can happen. So they shouldn't feel embarrassed. They should always reach out. It's very important. And I've had patients who've done great for 15 years and something happens in their life that takes them out of focus, whether it's an emotional issue, other stressors, that they lose focus and they start gaining weight. That's when I want them to come in. I haven't seen them for years. I want to see them now that they're struggling because I can provide that support. So the connection, the reaching out that you mentioned right now is very, very important. And our program is obviously very, very open to that because we know that that's a critically important component for success of our patients. To talk about fitness, Kemal, as you said, fitness is important, right? Our society, again, the way we are organizing it, it is sabotaging us, right? Because it discourages movement, it discourages activity. The foundation of movement, I tell my patients, is walking. Walking is the foundation because as human beings, excuse me, as human beings, we were built to walk. All our muscles, all our skeletons, everything was really built for us to be walking. And yet we spend very little time walking because everything is automated in our society. But the automation, the progress in technology also has provided us some tools. Now, all of us can actually track down our steps. We can see how many steps we've done at the end of the day just by carrying our cell phone with us, right? Some of us have smartwatches. Some of us have Fitbits. Important, right? Now, there is a number that I think is very important as a goal for people to have, right? All of us should strive at some point to get to 10,000 steps a day, right? Now, that's a goal. It doesn't have to be in one day. That's a goal. But we cannot get to that goal unless we track our steps. If we start tracking it, no matter how low we are, we will be able to tweak our routine the next day to add a few more steps, right? Whether it's parking further away, whether it's taking the longest route when you're in a store to go to a particular aisle. If you're in Christiana Mall and you want to go to Target, for instance, you can park by JCPenney, and then you will be walking all the way in the mall to get there, right? Now, once you are walking, well, not only you're adding steps, right? Not only you are adding activity and movement to your body, but every time you walk is one time less in which you're sitting and you're sedentary. So the trade-off is really critically important. So I emphasize walking as an important foundation that all of us should be striving for. Beyond that, of course, if we can devote time to do regular physical activity by going to the gym or in our house, obviously that is important and we should strive for that as well. But that foundation of making sure that we walk a certain amount during our day is critical, and walking can be incorporated in our daily life, right? Even if we work in an office where we are sedentary by the nature of our job, we should be able to find ways of making that walking happen. We can do that only if we track our steps.
Absolutely. Anything else that is important for our patients for this process, Dr. Irgau?
Yes, absolutely. So one thing that I want to reassure patients is that weight regain is not something that happens commonly. Of course, many of them may have seen friends or family members who had weight loss surgery, who drastically lost weight, and then they've seen them regain some weight. Well, we have to make a distinction between regaining weight and some weight gain. That's an important distinction, right? So from our point of view, what do we consider success in the long term? Well, in bariatric surgery, actually, we believe that if a person is able to lose 50% of their excess weight and they maintain that long term, that is success, right? Now, some patients manage to lose 80%, 90% of their excess weight, right? And then over time, maybe they may regain some, and they're about 60%. Right? Well, that's still good. So just because you've seen somebody who used to weigh 300 pounds and now they went all the way down to 150 pounds, which is great. But if suddenly over time they've gained, 20 pounds or 30 pounds, now they are stable at 180 pounds, that doesn't mean that person has failed, right? Kemal, they are still 100, 120 pounds lower than their highest weight. So we have to really understand that happens and that is common, right? But we're talking about maintaining the vast majority of the weight that you've lost in the long term. That's important. So the number of patients who actually regain all their weight back is really very small, right? Some patients can regain some weight, but staying on that regain path is obviously dangerous. That's when they have to reach out to us, and we can help them really get back or stay stable at a very acceptable weight.
So, Dr. One of the things that I don't know if you mentioned this in the beginning, binge eating, right? So, what's the proper, what's the best way to explain binge eating?
So we talked about that a little bit earlier on. We didn't say it's binge specifically because that has other connotations very often, but eating beyond fullness, right? Where it's painful, it's uncomfortable, or even leads to throwing up, Kemal. That is actually something that should never happen, right? Now, there are situations where people can fall into that, right? But if that becomes something that is happening all the time, particularly after bariatric surgery, not only it is harmful because they may be regaining weight, but it could be even dangerous, right? If you have a very small stomach and you are just eating beyond a certain level and then you're throwing up constantly, that can definitely cause some damage that may require medical attention. So that is definitely a no-no. So one of the important things that we teach our patients is to really stop when they feel full, right? Not to go beyond fullness, not to go towards discomfort, not towards pain, or worse, not to go until things cannot stay down any longer.
Well, that makes a lot of sense. I think the issue of the relationship with the food and what we make out of food and what it means for us it says a lot about our habits and other things that we do. But with a proper support and some daily discipline, we can actually prevent a lot of the potential challenges. And this is so important that this is our life, and we don't want to take this lightly. And for people feeling comfortable with their body, feeling healthy, living longer, being with their loved ones longer, these are all important things. And we want to be part of that, and we want to help our patients. Dr. Irgau, thank you so much for joining me today.
Thank you, Kemal. Yeah, great again, and have a nice weekend, everybody.
Thank you. Bye-bye.
Bye.